Welcome back. You're watching Low Country Live, and we're taking a better approach to pain management. Joining us today is Dr. Marshall Allen White, board-certified neurologist, to talk about chronic pain and what you are calling, Dr. White, the triad of misery. So what exactly is that triad?
Well, the triad of misery is a schematic that I developed over the course of my practice of 25 years for patient education purposes. And I feel very strongly that proper patient education improves outcomes and results that patients get, and it tempers expectations. People who are in chronic pain are not going to be cured in most cases of their chronic pain.
So that's what you based it off, that schematic right there, that triangle.
Well, that's the interesting part of this whole notion. My kids came home from school about 10 years ago with this schematic from the fire department that simply stated the three things that were necessary for the propagation of a fire, and that's oxygen, heat, and fuel. And it dawned on me at that moment that that's not dissimilar to what I'm doing in my practice of pain management. And so the triad that I have developed, I named the triad of misery because these three components of the triad can be really used as a framework to guide therapy for any chronic pain condition. And those three components are pain, and you can supplant inflammation there, or just say pain/inflammation.
Okay.
Sleeplessness and serotonin deficiency, and those three factors will feed on one another. And let's go back to that graphic again. Is it possible to do that?
Sure, we can put that right back up there. Now, you say that in this triangle method that if you have two of these things, the third thing is going to come.
That's exactly right. If you're experiencing pain and inflammation, that affects your ability to sleep.
Sure.
If your ability to sleep is affected, you lack stage 3 and 4 sleep. Stage 3 and 4 sleep is where human growth hormone is produced. That hormone is necessary for tissue healing. If tissue healing doesn't take place, that feeds the pain inflammation edge of the triad. If you are chronically sleep deprived and chronically in pain, you will deplete your brain of serotonin. That's basically the feel-good neurotransmitter in your brain, and that transmitter is also responsible for the initiation of sleep. So if you're deficient in serotonin, it fuels the sleeplessness, which again fuels the pain and inflammation. So you've got to take a comprehensive approach. That's great. You can take a comprehensive approach to pain management in almost any condition by addressing all three sides of the triad. And one of the reasons people are not getting the results that they need from their pain treatment is they're not addressing all three sides of the triad.
So what are some of the conditions that would lead to that triangle in those three symptoms?
Any injury, any surgery could lead to a situation where you develop pain following the surgery, you're not sleeping well, you start to develop two of the sides of the triangle, and over time all three sides will come into play and you'll develop a chronic condition.
So how do you attack this thing? Do you attack one of those problems? Do you attack two so the third one won't come out?
You attack all three simultaneously.
Uh-huh.
And one of the things that we do in our practice is to recognize that and use this schematic for purposes of patient education so that expectations are appropriately tempered. If you're not getting the relief that you need with your current therapy, then it's very possible and likely that one or two of the sides of this triad is not being addressed.
Can you describe some of the therapies that you offer? Is it a medication-based thing? Is it a stretching-based thing? How exactly are you going to treat those?
We use this schematic to describe to our patients how we're going to pharmacologically treat their problem. But physical therapies, for example, will go into relieving pain and inflammation, for example. And we want to try to avoid therapies that are invasive, like repeated injection and surgery, if at all possible. A lot of times patients have already had those things when they come to us, and we're dealing with a chronic pain situation that grew out of treatments that were designed to actually help the patient.
Indeed. Dr. White, if somebody is in pain right now, they're watching this at home and they want some relief, what do they need to do? How do they contact you?
Those are my contact metrics right there, but ask your physician about the things that we've talked about. Mention the fact that you're not sleeping if you're in chronic pain.
Okay. Dr. White, thank you so much for coming on the program. We do appreciate it.
Thank you.
Pleasure to see you as always. Stay with us. Much more Low Country Live coming up right after the break, so